The Mont Reid Visiting Professorship today is a really special event. I had the privilege of sitting with Dr. Johannigman, who is the president of the Mont Reid Society, and several of the fellow residents and colleagues of Dr. Nussbaum last evening, and hearing them reminisce about the camaraderie of being part of a very special training program and institution was so encouraging. The esprit de corps that you get by being a part of a group where excellence is the norm is something really special, and I don't think anyone here has contributed any more to that norm of excellence than Dr. Michael Nussbaum, who came here in 1981 from Pennsylvania and had the whole majority of his career here as first a resident and then as an attending. Mike's been away down in Florida for the last 7 years, and it's when he left, I think Gilda and I were talking about the gift that he received, which was a photograph of Barry Larkin, I think, as I recall, wasn't it, Gilda? Because I think that Dr. Nussbaum is much of a legend to the department as Larkin was perhaps to the Reds. But we welcome you back. It's fantastic to have you here.
Thank you.
And he's always been a historian, and he's going to tell us a little bit about the great legacy and history of this department.
Well, thank you. And it truly is an honor to be back here today and see so many of my old colleagues, new residents that I don't recognize, and to be the Mont Reid visiting professor. And as Dr. Edwards mentioned, surgical history has been a passion of mine since my days as a medical student at the University of Pennsylvania, our nation's first medical school, which was steeped in historical lore and tradition. Standing here today in this amphitheater, it's impossible not to feel the strong traditions and history that distinguish this department and institution. In 1990, Dave McFadden, Joe Fisher, and I published a centennial tribute to Mont Reid. This was published in the Annals of Surgery, and this was really the beginning of my fascination with the history of this department, and in particular about Mont Reid, who carries the name of a number of institutions from here. The Mont Reid Society, our surgical society, is named for him. Mont Reid Visiting Professorship, Mont Reid Handbook, which I was privileged enough to be part of the first editorial staff of the first edition of the Mont Reid Handbook. What was it about this gentleman who, when he died suddenly at the young age of 54 on May 11th, 1943, the entire city of Cincinnati mourned his passing. They flew the flag at half-staff on City Hall. And in fact, the American Surgical Association was meeting in Cincinnati, and they canceled that day's presentation so that everybody could attend Mont Reid's funeral. So when you sit in this amphitheater and gaze at the portraits above, you can't, this was a few years ago, there were a few less portraits back then, but you can't help but wonder about these men gazing down at you and think about the impact that they've had on generations of surgeons and their patients. So come along with me, and we'll spend the next less than an hour, hopefully, as I relate the story of the department. We're going to talk about primarily Ohio, where we are, but we'll go to Philadelphia, to Baltimore, to Virginia, Georgia, Jacksonville, and also a little side trip to Peking in China. From the beginnings with Daniel Drake to the consolidation of the departments of surgery in Cincinnati under Joseph Ransohoff, the beginnings of the full-time faculty with the recruitment of the Hopkins surgeons Hoyer, Reid, Zinninger, and Carter, the recruitment back home to Cincinnati of Dr. Altemeyer, and then the modern era. I consider the modern era because that's when I came to Cincinnati. Many of you probably think it's ancient history. Beginning with Joe Fisher, followed by Jeff Matthews, myself, and the current department under Dr. Edwards. So we need to go back in time Really, whenever you talk about anything historically in Cincinnati, you start with Daniel Drake. He's known as the Benjamin Franklin of the West. Osler was quoted as saying anything that was good and old in Cincinnati was founded by Daniel Drake. Drake was born he was born in New Jersey in 1785, and then the family migrated to Mayslick, Kentucky when he was 3 years old in 1788. At the age of 15, his father apprenticed him to Dr. William Goforth in Cincinnati, paid him $400. We got medical students here? Yeah, so $400 was the tuition to learn medicine from Goforth. Goforth said it would probably take about 4 years. It took Drake 2 years, and he got the first known diploma of medicine west of the Alleghenies. Now, Drake wasn't satisfied with just being an apprentice under Goforth, so then went to Philadelphia and attended my alma mater, the University of Pennsylvania, and was awarded a medical degree in 1807, and then came back to Cincinnati to set up practice. So in 1819, he obtained the charter for the Cincinnati College, which later became the University of Cincinnati. And just to give you some perspective what we're talking about, 1819, James Monroe was President of the United States, and at the same time, while Drake was founding the University of Cincinnati, Thomas Jefferson was founding the University of Virginia. And then in 1821, Drake obtained the charter for the Commercial Hospital and Lunatic Asylum, the hospital dedicated for the care of the poor. I mean, really, in those days, in 1821, if you had any means, you didn't have to go to the hospital. The doctors came to you and you paid for your medical care. And hospitals were basically built to take care of the poor and infirm. And the important thing about this hospital was this is the first time where medical education was linked to the care of the indigent. And for the next 32 years, Drake would play a major role in the development of medical education and medical care in this city. He was described as brilliant, larger than life. He stood 6 feet 5 inches tall and towered over everybody else, and was not known for being much of a negotiator. He settled most things with his fists in the streets, and in fact kind of outwore his welcome, and was eventually expelled from the Medical College of Ohio that he formed. It's kind of like a Steve Jobs Apple back in the 19th century. Went on and formed the competing medical school, the Miami Medical College, and continued to live and practice and educate until he died at the age of 67 in 1852. Joseph Ransohoff was born less than a year after Drake died, on May 26, 1853. He grew up on this street. This was known as Bremen Street back in Over the Rhine back then. After World War I, or during World War I, they changed all the Germanic names of the streets to more patriotic sounding names. So Bremen became Republic, and this is the street, and that's St. Francis Church right up the street on current day. But he was the youngest son of Nathan and Esther Ransohoff. They hoped that he would become a rabbi and trained him that way, but he decided to go into medicine instead, which is certainly fortunate for all of us, but his parents probably never got over that. He attended Woodward High School. The original Woodward High School was the first public high school in this part of the country. It was at 13th and Woodward Streets. The old School for Creative and Performing Arts was Woodward High School for many years before it became the School for Creative and Performing Arts. When he was a senior, a freshman at that school was future President William Howard Taft. And that'll become important later because they will cross paths again. Ransohoff passed directly from high school into medical school at the Medical College of Ohio. Again, the Medical College of Ohio, founded by Daniel Drake, the second oldest medical school in the West, and one of the largest and best known schools in the country. And there were many distinguished individuals passed through those doors. One of the earliest, most prominent individuals, John Shaw Billings, graduated in 1860. He served as the medical inspector for the Army of the Potomac during the Civil War. He was known for his organizational abilities. He drew up the original plan for the Johns Hopkins Hospital and Medical School. He founded the Index Catalog and the Index Medicus. And he served and oversaw the National Library of Medicine for 30 years, from 1865 to 1895. Went on also to found the New York Public Library. Another interesting thing about Billings, in order to catalog and organize things, he developed a system of punch holes in cards, and was really the beginnings of digital technology and computers back in the late 19th century. Because of the many slaughterhouses that were here in Cincinnati at the time, and the difficulty getting human specimens, a lot of anatomists chose to come to Cincinnati to work in the study because there was a ready supply of organs and animal parts, much like our simulation labs today. And one of those who came was Samuel Gross. And Gross served from 1833 to 1840 as demonstrator of anatomy, and with the help of the materials supplied by the slaughterhouses, performed most of his most seminal work related to anatomy and operative surgery. He then was recruited away from Cincinnati to become the professor of surgery at the University of Louisville. And then in 1856, Gross returned home to Philadelphia to serve as a professor of surgery at Jefferson Medical College. And this is the famous Thomas Eakins portrait of Gross, painted in 1875, known as the Gross Clinic, and still hangs today now, no longer at Jefferson, but at the Philadelphia Museum of Art next to Eakins' other painting of Dr. Agnew. Gross went on to found the American Surgical Association, our oldest and most prestigious surgical organization in this country. So after medical studies, and before graduating from medical school, students would go on and perform an internship, and Ransohoff spent a year of internship at the brand new, only 5 years old, Cincinnati Hospital. When this hospital was completed in 1869 at an exorbitant cost of $1 million, it was considered the most magnificent structure of its kind on the continent. And for many years, it really was one of the great architectural attractions in the city. The hospital was built on the banks of the Miami and Erie Canal, which no longer exists. It's now Central Parkway at 12th and Plum Street. So here's 12th and Plum Street today, a little bit different than how it looked back in 1869. The hospital had nearly 500 beds and served all the medical students in town as a school of clinical medicine. Again, mostly indigent patients here. This is the children's and women's ward. Clinical lectures were held daily in the amphitheater, and medical students could attend for a cost of $5 a day. Again, tuition costs have gone up slightly since then. After his medical studies and serving an internship, Ransohoff graduated from the Medical College of Ohio in February of 1874. Graduation ceremonies were held at the old Pike Opera House, which was at 4th and Vine Street. The Medical College of Ohio sat at 6th and Vine Street, so right around the corner. He was the youngest graduate from his class, and then in accordance with his father's wishes and really the traditions of the day, Ransohoff left Cincinnati and went to Europe to spend 3 years studying at all of the major medical centers on the continent. So he went to Würzburg, Berlin, Vienna, Paris, and then ended his studies in London. And he studied with the likes of Virchow here, Langenbeck, Bill Roth, Rokitansky, and then ended up in London studying with Paget and studying for and rapidly achieving first membership of the Royal College of Surgeons and then fellowship of the Royal College of Surgeons over it usually takes several years. He did it in 3 months and then returned to Cincinnati in 1877, where he then continued a long and illustrious career in Cincinnati. So from the beginning of his medical life, he was closely associated with the Medical College of Ohio. And in the summer of 1877, he was named demonstrator of anatomy. 2 years later, the professor of descriptive anatomy, Landon Longworth, died, and Ransohoff was made professor and chair of descriptive anatomy at the Medical College of Ohio. So the current era of the University of Cincinnati College of Medicine and the Department of Surgery really began around this time in 1887. So we had the Medical College of Ohio, The Miami Medical College, remember both of those founded by Daniel Drake, competing entities. And then there was a third entity, the Cincinnati College of Medicine and Surgery, which would last until about 1902, and then the Cincinnati College went defunct. But they were trying to form an affiliation between these three, which seemed to be going well until the Medical College of Ohio moved into this building. It's a 4-story building that was built on the campus of the University of Cincinnati on McMicken Street. These two were downtown, as was the Medical College of Ohio, so the relationship fell apart and wasn't to be reconvened or put back together for another several decades. Now, the medical department of the University of Cincinnati began at that time with the move into that new building. The chair of surgery was Phineas Sanborn Connor, who served as chair from 1887 until 1902. And really then at the turn of the century, nobody in Cincinnati was more politically connected than Joseph Ransohoff. And he succeeded Connor as the chair in 1902. In 1903, he was appointed to the Board of Trustees of the University of Cincinnati, and it was in this role that he played a very important role, first in helping get rid of the sitting president of the University of Cincinnati, Dr. Howard Ayers, who was unpopular, and they just had to figure out a way to get rid of him. And then he went with a contingent down to the University of Tennessee and convinced the sitting president of the University of Tennessee, William Dabney, to come to Cincinnati and become the president of the university. Now, Dabney was, what was appealing to Ransohoff and most of the people on the medical faculty was Dabney's interest in standardizing curriculum, offering more science, and really promulgating admission criteria to get a higher quality student at the university, and really structuring the curriculum so that the graduates would be so-called first-class graduates. And so Dabney recognized the importance and the need, again, to bring the two competing medical schools together and to merge with the Miami Medical College. And at the time, neither of the medical colleges were doing very well from a financial standpoint. Neither had the wherewithal to continue to provide the education and the research and such. And Dabney convinced the two entities to come together. And one of the ways that he was able to do this was he agreed to serve not just as the president of the university, but as the first dean of the medical school. So you can imagine being the president of the university and running a medical school was challenging. And in one of his, purely a stroke of political genius, a year later, he appointed Christian R. Holmes as dean of the medical school. Right there is a plaque identifying Christian R. Holmes. Holmes was a graduate of the Miami Medical College. He was on the faculty of the Miami Medical College. He was a very prominent otolaryngologist, ophthalmologist, and was well respected by both faculties. So it was the perfect way to bring the two institutions together. The other important fact was not only was he very prominent in the medical community, but he married well. Holmes married Betty Fleischman. Fleischman was the daughter of Charles Fleischman, the wealthy, politically powerful Fleischman family. So it didn't hurt to have the dean of the medical college married to one of the wealthiest, or the daughter of one of the wealthiest and most influential men in Cincinnati. So by the turn of the century, this hospital, the Cincinnati Hospital, had lost some of its glimmer that it had back in 1869, was overcrowded, conditions were deteriorating, and the other concern was, again, remember, this was down at 12th and Plum Street. The medical school was now up here on this campus, over closer to the undergraduate school off of McMicken Street. And Dabney was very concerned that it was disconnected and really thought that it would be best to move or to build a new hospital on this campus. It didn't hurt that the mayor of Cincinnati was none other than Julius Fleischman, Holmes's brother-in-law. So Dabney, Fleischman, and Holmes all concluded that they really wanted to follow in the in the example of the Johns Hopkins. Remember, Billings designed the Johns Hopkins Hospital and Medical School that opened in 1889. It was a hospital that was adjacent to a medical school and was built purely dedicated to the education of medical students and physicians and caring for the patients. Now, this was moving from downtown out to the fashionable suburbs of Avondale was, from a political standpoint, not looked upon very favorably by the city fathers, because they claimed the university was basically trying to leave their mission of taking care of the indigent and the poor who lived mostly downtown. But they got support from the city financed it, and in 1915, the Cincinnati General Hospital and the College of Medicine building were completed on the same grounds. So this is Burnett Avenue. This was the initial building, the old administration building, and then the pavilions behind here. So today, this is Burnett Avenue. This is where the current Shriners Hospital sits. When I came here as a resident, that building was still there. We used to do endoscopies right over here. I don't know, Jay probably remembers doing that. And then the original medical school building is here. This is the health professionals building that sits on Eden Avenue. So this was at the far end of the hospital campus. So here's how it looked in diagram, and there's a picture of this out in the hallway if you want to study it further. But again, Burnett Avenue here, this was the medical school. This is Eden Avenue, that's still there, isn't it? The smokestack, the power plant. And not all of these pavilions were built, but this was the last of the great pavilion-style hospitals. Pavilion hospitals were built such that you could isolate infectious diseases to individual buildings, and lots of open green space, because a lot of the treatments for many of these infections, particularly tuberculosis, was so-called heliotherapy, getting patients outside in the sunshine. We didn't have antibiotics, and so you basically isolated people until their infections ran their course, and you put them outside and you hope that they would get better. On the first day that this opened, 80,000 people from the city came to the opening. And it was truly considered one of the most magnificent structures ever built at the time. The next step to establish full-time chairs for teaching and research, as recommended in his seminal work by Abraham Flexner in 1910, was to develop the funding for full-time chairs. Ransohoff, along with Holmes and Dabney, set the stage for the establishment of such a position now that the two medical schools had combined and you had the University of Cincinnati College of Medicine. So from 1902 until the time of his death, Ransohoff occupied the chair of surgery of the Medical College of Ohio, and then subsequently the combined medical schools at the University of Cincinnati. His home was just a few blocks from campus on the corner of Vernon Place and University. And in his capacity as chair, and with the opening of the Cincinnati General Hospital, he was the director of the first surgical service there. He was also surgeon to the Jewish and the Good Samaritan hospitals, and his success as a teacher is attested by the veneration in which he was held by his former students, and he was called a fearless operator, undertaking operations which, quote, staggered his confreres by their temerity. He was also an enthusiastic investigator, many original ideas, published over 140 articles in the medical and surgical journals, and his diversity of interest was quite remarkable. He was a pioneer in the fields of urology, orthopedic surgery, gynecology, neurosurgery, thoracic surgery, surgical oncology, vascular surgery, and abdominal surgery. He was one of the first followers of the dictums of Reginald Fitz to perform appendectomy for appendicitis. And Samuel Gross once remarked and placed Ransohoff along with Coker, Keene, and Lawson Tate as one of the pioneers in gallbladder surgery. He was the first American surgeon to perform a gastroenterostomy. And so, when his old schoolmate, William Howard Taft, needed a surgeon, so Taft was the governor of the Philippines from 1900 to 1903. In 1901, Taft developed a perirectal abscess, which had to be incised and drained. He was septic, he was near death, He had it in his eyes and drained, no antibiotics. It recurred. He had it drained again, at which point he developed a chronic fistula and had sought out consultation in Washington, in New York. And then he called his friend Frederick Forsheimer, another graduate of Woodward High School. Forsheimer was the chair of medicine here at the University of Cincinnati, and he asked Forsheimer what he should do. So Forsheimer said, well, you know, you could always go to Howard Kelly at Johns Hopkins. He said he could take care of you, he'll do a fine job, but they'll overcharge you. He said, you can come back to Cincinnati, you know, sir, I can get it for you wholesale here. Said, you can come back to Cincinnati, and I have just the guy to do it, but you can't tell anybody I told you, because at the time, he told him he should see Ransohoff. Connor was still the chair of surgery, and it wouldn't have been good for the chair of medicine to refer as prominent a person as the governor of the Philippines to somebody other than the chair of surgery. But he said, sir, you know, on the hush-hush, you should contact Joseph Ransohoff. They knew each other from their early days. So he contacted Ransohoff. Ransohoff admitted him to the Jewish hospital, operated on him, did a fistulotomy, and Taft never had any further problems, went on to become Secretary of War, President, and Chief Justice. So all to the thanks of Dr. Ransohoff. So let's diverge a little bit. Mont Rogers Reid was born in 1889 in the small town of Orskany, Virginia. He attended Roanoke College, received a bachelor's degree in 1908, and then applied for a Rhodes Scholarship, lost by 1 point to his brother, who got the Rhodes Scholarship. So second prize was a scholarship to the Johns Hopkins to study medicine. And actually the people in the town, he didn't have enough money to live and to go to school, so they raised money so he could go to Hopkins, and he attended Hopkins, and graduated in 1912 and was offered an internship there, followed by residency, and then chief residency to work with this man, William Stewart Halstead. This is Mont Reid as a chief resident. Joe Fisher used to say that this was, Mont Reid was asking Dr. Halstead when he would be finished, and Dr. Halstead would say, when, in time, Reid, you know. So residencies, chief residencies lasted as long as the professor said so. And so he served as a chief resident for 4 years, from 1918 to 1922. Part of that was one of his fellow residents who was supposed to precede him was actually killed during World War, or died during World War I of the Spanish flu of the 1918 influenza epidemic. This guy's picture isn't on the wall. This is Edward Jelks. I bet you nobody knows who Edward Jelks is. Maybe Sue does. But Edward Jelks was born in Hawkinsville, Georgia on July 9, 1888. He was raised in Macon, Georgia, attended Mercer University, and then went to Johns Hopkins and graduated a year after Mont Reid in 1913. Jelks took a general residency, not a surgical residency, in 1913 and 1914. So he was a resident at the time that this famous photograph was taken. So this was the Hopkins faculty 25 years after the founding of the Department of Surgery. So let's point out, this is Halstead, flanked on either side by Finney and Bloodgood. And then the back row is an interesting assortment of individuals. This is Roy McClure. He was chief resident at the time in 1914. This is Hugh Young, the founder of modern-day urology. Harvey Cushing, neurosurgeon. And Cushing had left Hopkins in 1911 to become surgeon-in-chief at the Peter Ben Brigham Hospital and to start a school of surgery there. James Mitchell, Richard Follis, famous for performing the first operation on Dr. Halstead's gallbladder, taking out his gallbladder but leaving a stone behind in the common bile duct. That will become important later. Miller, Churchman, and off here, one of the junior faculty members, George Hoyer. Off to the side when this picture was being taken were several of the other residents. Walter Dandy was off to the side, intern Barney Brooks, and second assistant resident Mont Reid were there but were not in the picture. Halstead was impressed during 1913 and 1914 with Edward Jelks and offered him one of those coveted surgical residency positions, but Jelks declined. He declined because Jelks' father had suffered some significant financial losses, and Jelks couldn't afford to be a resident any longer. He really had to go into practice and make a living so that he could help support his father and his mother and his family back in Macon. And the majority of people did a year or two of residency, then went on and would usually just latch on to somebody in a specialty that they were interested in and learn from them. So Jelks was offered a job by Dr. Carrie Rogers, another Hopkins alumnus, who was practicing surgery, the first person to limit his practice to surgery in the state of Florida, down in Jacksonville. Jacksonville is not far from Macon, so Jelks decided to go to Jacksonville and join Rogers in the practice of surgery in Jacksonville. Max Zinninger was born several years later in 1895 in Paris, Ohio. His father was a general practitioner who practiced in Canton, Ohio. And Zinninger's first exposure to surgery was watching his father administer open drip anesthesia, ether anesthesia, to some of his patients who were undergoing operations. And he soon decided to set a course of education that would lead to a medical education. Zinninger attended Harvard College, graduating in 1917, and then again went to they all seemed to funnel to this one institution. This was the primary place to get a medical education in the late 19th and early 20th century, the Johns Hopkins School of Medicine, graduating with honors in 1921. He thought about what he wanted to do. He actually wrote that he thought he'd be a medical man, but then decided that treating patients with incurable diseases such as diabetes, cirrhosis, pernicious anemia, atherosclerosis was frustrating, and he was impressed with the fact that the only patients that seemed to get cured and get well and leave the hospital were surgical patients. So he wanted to be a surgeon, applied for and received a surgical internship at Hopkins in 1921. Joseph Ransohoff suffered a myocardial infarction in the summer of 1920. This was complicated by progressive congestive failure. No open heart surgery, no assist devices back in 1920. And he died at home on March 10th, 1921, of cardiac failure. And the void that was left at the time of Ransohoff's death in 1921, Holmes had died 3 years earlier in 1918, but it really was the impetus to funding and the establishment of the endowed chair, the Christian R. Holmes Chair of Surgery. And with the money available, the University of Cincinnati recruited George Hoyer to come from Johns Hopkins. So Hoyer accepted the professorship of surgery in 1921. He was going to bring his brother-in-law along, Mont Reid, who had just completed his chief residency, and was planning to establish a surgical training school at the Cincinnati General Hospital, much like Harvey Cushing had done at the Brigham, much like Roy McClure had done at Henry Ford, much like Barney Brooks had done at Vanderbilt. As a surgical intern, Zinninger became more and more convinced that he wanted to go into surgery, and he really felt that the only way to become a well-trained surgeon was to do a residency, and really hoped to get offered the residency position at Hopkins. But he was not invited to become a resident at Hopkins. So then he had to decide what to do, and his options were few in number. He could return to Canton, much like Jelks did, going to Jacksonville and just link on with a surgeon and learn surgical technique from an individual there, and there was opportunity to do that, but he really didn't consider that. He could apply to join Cushing, but the program at the Peter Van Brigham was pretty much a closed shop, open primarily to the Harvard medical students. Brooks had established a program at Vanderbilt. He was offered a residency position at the Union Protestant Infirmary, now the Union Memorial Hospital in Baltimore. It was founded by a number of Hopkins-trained surgeons, but his concern there was Union was primarily a private hospital, and he didn't feel that he'd be given the independence that he would be given at a true university or teaching hospital. And then Hoyer was offered the professorship in Cincinnati, and Hoyer offered Zinninger the opportunity to join him in the first class of residents. So that summer of 1922 was fairly noteworthy for Max Zinninger. First of all, he met Elizabeth Kennedy, a nurse at Hopkins, and they planned to be married. Before they got married, he checked with Mont Reid. He didn't check with the professor, but he checked with Mont Reid. He said, "Do you think it would be okay if I got married?" Because in those days, you really weren't allowed to be married and be a resident. And Reid said, "Yeah, I think it'll be okay." And so he went ahead. They planned. So let's talk about being efficient. He ended his internship on August 24th, 1922. They were going to be married that evening, and then they were going to head off to Cincinnati. And so that afternoon, after finishing rounds, Zinninger went down to the loading dock with his trunk to be shipped to Cincinnati, and he's standing there in the loading dock, and a car drives up. And much to his surprise, stepping out of the car, George Hoyer and Mont Reid, who he thought were in Cincinnati. And they had very grim looks on their faces, and he was like, taken aback. What were they doing here? And soon he found out what they were doing there. Their patient was Dr. Halstead. Halstead, they had brought him back from High Hampton in Cashiers, North Carolina. He was deeply jaundiced, dehydrated, septic, and looked pretty bad. So Hoyer and Reid operated on Halstead the next day. He had a common duct stone obstructing his common duct. It was supposedly a difficult operation, but they got the stone out, and he was stable post-operatively. Again, much like the professor, Hoyer had to get back to Cincinnati. He turned to Reid, he said, "Stay with the professor, don't let anything happen to him," and he left. So Reid supposedly stayed at Halstead's bedside night and day for 9 days, watching after him, making sure that everything was attended to him. Finally, by about day 9, Halstead looked pretty good. And Reid was exhausted, and one of the things, Mont Reid was a huge baseball fan. And the old Baltimore Orioles from the International League were in town, and they were playing, and he decided he'd go down, what could hurt, go to the ball game for a couple hours. No pagers, no cell phones, no way to reach him. He goes to the ball game, comes back, and finds out that while he was gone, Halstead had an upper GI bleed, vomited, aspirated, and was in pretty severe shape. And several days later ended up dying, combination of anemia and aspiration pneumonia. And as long as Reid lived, he never forgave himself. Now, there's not much he probably could have done for Halstead at the time, but he never forgave himself for not being there at the time that the professor had his upper GI bleed. So in September 1922, Zinninger joined George Hoyer, Mont Reid, Nolan Carter. I'm not sure which one of these guys, this one, and Roger may know, this was either Andrus or Sutton, and then Charles, huh?
It's Glenn Bell.
Oh, that's Glenn Bell. Okay, Glenn Bell. He was another one. Charles Bidgood, all from Hopkins. And the attending staff was basically Hoyer and Reid. And they were known not too kindly in this city at that time as the Hopkins invasion. This new regime was not hailed by delight by most of the practicing surgeons in Cincinnati. And Hoyer and Reid didn't do a whole lot to endear themselves to the surgeons in town. And there are some great letters back and forth between Reid and Halstead. This was before Halstead's demise, talking about what the practice of surgery was like in Cincinnati. And if you want to read those are all in the archives at Hopkins, and some of that is in that paper that Dave McFadden and I wrote many years ago. But most of the surgeons in town wanted nothing to do with these guys, with a few exceptions. And those exceptions, who did not consider them persona non grata, were very important to the building of this department of surgery. One was John Caldwell. Caldwell was one of the best known surgeons of the time, and he really became intimately associated with the new regime and stayed on and served on the faculty for several decades, teaching medical students and residents. Another was Dr. Howard Shriver, who taught surgery to the medical students from 1922 until he retired in the 1950s. Dr. Lou Ransohoff. So Lou Ransohoff, son of Joseph Ransohoff, was a prominent surgeon, primarily practiced at Jewish Hospital, but gave a clinic to the junior medical students and the residents through the 1950s. So Lou Ransohoff was the father of William Ransohoff, a practicing internist in this town for many years, and Helen Glick, Helen Glick, certainly Bob Hummel, J. Joe Hanigman, Wes Alexander, Tracy Shriver remember Helen Glick. Helen Glick was one of the most prominent hematologists of her era, an expert in coagulation, and practiced here for many years, into her 90s at this institution. But Lou Ransohoff was very loyal to the professors. Ralph Carruthers and Charles Langdale also served on that original faculty. Meanwhile, in 1925 in Jacksonville, and much like Hoyer and Reid in Cincinnati, Cushing in Boston, Brooks in Nashville, McClure in Detroit, Edward Jelks established a surgical residency at this institution, the Duval Medical Center, which he patterned after Halstead's training program at Hopkins. This was the first residency training program of any kind in the state of Florida, and continues to this day at my home institution, the University of Florida College of Medicine, Jacksonville, where I'm program director and continuing to trying to follow in the heels of people like Jelks, Hoyer, and Reid. So some months prior to completing his residency, Zinninger was trying to figure out what he was going to do after residency. So Hoyer called him to his office and asked him what his plans were. Sound familiar? He'd not decided. He thought about maybe going into private practice in Canton. His father was still in practice there, but he said his wife really wasn't keen on moving to Canton. He'd been offered a private practice job in Cincinnati, but he wasn't real keen about that. And Hoyer said, I've got a great idea for you. Join us. We can't pay you very much, but you join us and you can be part of this faculty, and you'll be able to supplement your income because we need somebody to assist us in our operations when we go and practice at the other hospitals in town. We only have residents here, and they would either take senior residents with them or junior partners. So what was very important here is that Zinninger learned how to be an assistant, which became very important throughout his career in assisting surgeons, and particularly helping surgeons who may have had less talent than he had to get out of difficulties. So this appealed to him, and he joined the faculty and rapidly rose from instructor, was offered a position at the University of Virginia but turned it down, and was made an assistant professor in 1928. At the same time, Reid suggested that he go off and spend a few years away from Cincinnati, so sent him to the Peking Union Medical College in Peking, China. That was still the most prominent medical college of its time in China, and he served as a professor of surgery there for 2 years. I think this is the first documented international rotation from the Department of Surgery. Where's Jocelyn? So, there you go. So, and then he decided, and then he's coming back after spending 2 years in Peking, and there were quite a lot of changes afoot when he got back to Cincinnati late in 1930. Because he found out that Hoyer had accepted the professorship of surgery at Cornell and was going to start a residency there, was taking Andrus with him, and Hoyer offered Zinninger to come along. Reid said, no, I want you to stay here with Carter and me. Glenn Bell, who Roger pointed out was in that original picture, Glenn Bell had gone off to the University of California in San Francisco with Nafziger and started a residency there and wanted Zinninger there. But he decided, as he said, to cast his lot with Mont Reid. And by doing that, the rest, so-called, is history, because he never left Cincinnati after that time, never considered leaving the university. So Hoyer left the end of June 1931. Reid was made the second Christian R. Holmes professor, and the teaching staff at that time consisted of Doctors Reid, so Reid's here in the center, Carter here, Zinninger here, and Herman is here, a number of others here, but so that was the faculty back in 1931. And they began to expand the department. And Reid was really the real architect of building the department to what it then became. And this was 1931. It was right after the stock market crash. It was the middle of the Depression. Money was hard to come by. Zinninger was always amazed how Mont Reid could always come up with money, and he never knew where it came from. But Mont Reid got $10,000 and invested it in a supply of radium for the tumor clinic. and then he picked one of the junior residents, William Millar, sent him to Chicago to learn how to use the stuff, and then Millar came back and started the tumor and radiation clinic and soon recruited Esther Martin to join him. Now, Millar may have learned how to use radium to treat cancer, but they didn't teach him how to protect himself, and rapidly developed Hodgkin's disease and had to retire. So Martin was made the chief, and Martin recruited a young, promising resident, Charles Barrett. So Charles Barrett joined Martin in the tumor and radiation clinic, and Charles Barrett became the director of the Division of Radiation Oncology in the Department of Surgery for many years, and also served Cincinnati in many ways, leading radiation oncology. He was a respected business and civic leader, founding the Western Southern Life Company, and also financed the building and the establishment of the Barrett Cancer Center. And Bill Barrett, his son, still remains the chair of radiation oncology today. So for the next 12 years, Zinninger helped Reid build the Department of Surgery. And in addition to Millar, Martin, Barrett, Reid brought in Dr. Lewis Herman from Cleveland to help in the care of patients with surgical diseases of the vascular system and large arteries. As promising residents completed their residency, they were added to the department, including Dr. Gene Stevenson, father of Richard Stevenson from pediatric surgery. Vinton Hoppy Seiler and Paul Hawksworth in 1941. And again, Zinninger was always amazed. Reid was constantly hiring people, and he never knew where he was coming up with the money, but he was always seemed to be able to pay salaries and make payroll. So let's diverge a little bit. Let's go back to 1910, about the time of the Flexner Report. July 1910, William Altemeyer is born in Cincinnati. As an undergraduate at Cincinnati, he excelled both in his studies as well as he was a prominent catcher on the University of Cincinnati baseball team, and caught the eye of a scout for the St. Louis Browns, who offered him a contract. And he decided, after much soul searching, to pursue medical studies rather than to go on to pursue a career in baseball, which, again, fortunate for us, these sort of somewhat serendipitous decisions that are made by individuals affect all of us for many years. So he studied microbiology with William Wary while in medical school, which began his long and lifelong interest in surgical infections, bacteriology. And then after graduating from the University of Cincinnati, he wanted to do a surgical residency, went to Mont Reid, and he was married. And I point out, Reid had made an exception for Zinninger, was not going to make an exception for Altemeyer. He said, unfortunately, you can't be a resident here. But remember, his chief resident, Roy McClure, had a residency at Henry Ford, and McClure was a lot more liberal in those days and allowed residents to be married. He said, you can go train with Roy McClure, you'll learn how to be a first-class Hopkins-trained surgeon, and then we'll bring you back here after you get your training. So Altemeyer went to Henry Ford and trained with Roy McClure. So during the building of the Department of Surgery, Max Zinninger also served the university as an assistant dean. And then with the financial help of his friends, Reid was able to make improvements in the Department of Surgery offices. That was then, I believe, in C Pavilion. General surgery, radiation oncology, cardiovascular diseases were covered. So then Reid went out and recruited Joseph Evans from Montreal to begin a division of neurosurgery. And things were really cooking between 1935 and 1939. 1941, Dean Lewis, the chair of surgery at Johns Hopkins, who had succeeded Dr. Halstead, died. And the number one choice to replace him was Mont Reid. So Hopkins came calling, and they offered Reid a lot more resources, a lot more money to come back to Baltimore, and he considered it. His wife was from Cincinnati. She really didn't want to move back to Baltimore. Zinninger and Carter said, no way, they're not going back to Baltimore. And he wasn't sure if he wanted to do that. And then what convinced him was a group of leaders from the city came to him and offered him $20,000 a year for 10 years if he would stay in Cincinnati and continue to build the department. And again, $200,000 for 10 years was a large sum of money in those days. And so with that money, he used that to recruit William Altemeyer back to Cincinnati. And other important contributions that he did was he really felt that they needed a new service building for the hospital. And he again went to the city and got the city to help fund a new pavilion that was going to be known as the Daniel Drake Pavilion. But unfortunately, at the time of the opening of the pavilion, Mont Reid had recently died, so they changed and they decided to name the pavilion the Mont Reid Pavilion, still a central structure in this institution today. So at the time of Reid's death in 1943, Nolan Carter was the heir apparent, but he was working in the Surgeon General's office during World War II and after World War II, so Max Zinninger was the acting or interim chair. There have only been 2 interim chairs of the Christian R. Holmes professors, Max Zinninger and that guy over there. So I always have had a great affinity for Dr. Zinninger, who held things together for 3 years while the institution mourned the death of Dr. Reid, and they were waiting for Dr. Carter to return from the Surgeon General's office. Once Carter returned, Zinninger was named the assistant director of the Department of Surgery, a post that he held for until 1961 under both Carter and Carter's successor. He became full professor in 1952, and he had a long-standing interest in surgical pathology, which goes back to his days at Hopkins and working with Bloodgood at Hopkins. And he taught the medical students and the residents surgical pathology. He was made emeritus professor in 1961 and remained an active participant in the department up until the time of his death. And he was really an outstanding and selfless teacher of medical students, residents, and colleagues. I did not know him personally, but probably several of the older faculty remember him. And he was known for his integrity and his discretion, and made a long succession of surgeons would seek him out for help. Again, go back to when he was first hired as an assistant for Hoyer and Reid. And his patients knew him for his technical skills. He was a surgeon to many of the faculty at the University of Cincinnati. And he was on the staff of most of the local hospitals. And in that capacity, when a surgeon got into trouble or had a difficult case, they would call Dr. Zinninger. He'd come in, he'd help them. No fanfare, would never make a big deal, always make the surgeon feel like they had done everything and he was just there to help. And many years later, one of these surgeons who felt very indebted to Dr. Zinninger for getting him out of trouble on multiple occasions approached Dr. Fisher and endowed the Max Zinninger Award, which you still give today, and is a very prestigious award given to the outstanding resident who best exemplifies what Max Zinninger stood for. So as I mentioned, William Altemeyer was recruited back to Cincinnati by Mont Reid, and he embarked on an illustrious and very productive career with a focus on surgical infections, along with, and this was the beginning of the antibiotic era. I think Dr. Altemeyer had the first supply of penicillin in Cincinnati when he came back. He also had an interest in shock, trauma, and burns, and he rapidly rose through the ranks to professor. And then in 1952, when Carter announced that he was retiring, Altemeyer was made the Christian R. Holmes professor and chair. And Dr. Altemeyer is the longest tenured of the Christian R. Holmes professors, serving from 1952 to 1978. And he further expanded the department with a real focus on microbiology, intra-abdominal infections, establishing the department as a pioneering center for surgical infections. The peritoneal repair for rectal prolapse is named for Dr. Altemeyer. Dr. Altemeyer was the first to describe cancer of the proximal or hilar bile ducts, which carries the name of Klatskin, but Altemeyer was the first to describe the so-called Klatskin tumors. Again, he recruited many faculty, several of whom are sitting here today. Dr. Alexander, Dr. Hummel, Dr. Schreiber, Dr. Albers, I thought I saw was here. And along with that, they built the first Shriners Burns Institute with the help of Dr. Hummel and Dr. McMillan over on Goodman Street, where now the French Hastings building is. But that was one of the first Shriners Burns Institutes in the country. And Dr. Altemeyer served nationally as president of every major surgical organization, including the Surgical Infection Society, which he helped found, received the Distinguished Service Award from the American College of Surgeons, the highest award from the college, fellow of the Royal College of Surgeons of Edinburgh, and raised the funds to build the Surgical Research Unit, the place where the Department of Surgery sits today. And many of us had a chance to work with Dr. Altemeyer. He died in November 23rd, 1983. When I came to Cincinnati for surgical, well, I'm sorry, I'll go back here. I began my residency in 1981, and Dr. Altemeyer was still very active operating with Dr. Culbertson over at the Holmes Hospital, and had the real privilege to work with both he and Dr. Culbertson and watch true master surgeons work and do bowel anastomoses and manage complex GI and surgical infections. Again, when I came to Cincinnati in 1981, I was looking for a place where I could become an academic surgeon, and I was looking for a residency that would foster that ambition and pursuit. And the primary reason I chose this institution was because the chairman, Joe Fisher, who had been here for about 3 years, really made it clear that this was a program on the rise, and a chairman who was passionate about excellence in patient care, science, and above all, resident education. When he came in 1978, the faculty, you could count the number of full-time faculty on one or two hands. When he left after 23 years in 2001, there were 60 full-time members of the department, and following in the tradition of his predecessors, Dr. Fisher really established a school of surgery of his own. Trained many residents, many of whom are sitting in this room or are prominent academic surgeons around the country, recruited many faculty, and certainly we owe a lot to what Joe did over his long tenure here. As Surgeon-in-Chief, he was instrumental in many sweeping changes that occurred at the medical center. He played a key role in transforming Cincinnati General Hospital to University Hospital, and holds the distinction as being the first faculty member to admit a private patient to the Cincinnati General Hospital, Jay's uncle. He helped establish UC Physicians, the largest multi-specialty group in Cincinnati. He was part of the original planning group that saw the need to build a second campus north of town at Westchester, and also helped establish the Medical Center Fund, which really is the underpinnings for the finances of all the departments. Received, again, many honors, much like Dr. Altemeyer, and was president of multiple societies, also served as chairman of the American Board of Surgery. When Dr. Fisher left, he was succeeded by Jeff Matthews, and I was privileged to serve as Jeff's vice chair, as well as I was chief of staff, and worked closely with Jeff for the 5 years that he was here. And then when he left, I was again privileged and served the honor of, much like Max Zinninger, being the interim chair, and also at the same time serving as chief of staff at the University Hospital and program director. And then when I left Cincinnati for the beaches of Northeast Florida, I knew the department was in capable hands of another surgical leader who would follow in the legacy of all who preceded him, with the continuation of the tradition of patient care, teaching, and research that has distinguished our department from the days of Daniel Drake to the present. So again, I thank you. This is truly an honor to return really to my home. As we talked about last night at dinner, I live in Florida. Cincinnati is my home. This is where I grew up. This is where I learned how to be a surgeon, thanks to the legacy of these chairs and then all of the faculty that contributed to my education and continue to contribute to all of your education. So I thank you very much, and am glad to be here again. Thank you.
I always forget to do this.
We got a couple of them. This is the newest one. It's over there on the card.
It's on the card?
Yep.
Oh, yeah, okay, thanks, Jay. I always forget.
How many of these do you have now?
Oh, thank you. I never have too many. Thank you.
adjourned. Thank you.